Hey everybody, Dr. Tam here, your pain specialist here in Vacaville, California, where every single week I try to give you tips on how to decrease your pain, improve your function, and also your longevity. So we had a patient ask us this week, my husband is suffering from back pain. When should I come in? Well, of course, as a doctor, my first response is the moment you start noticing back pain, you should start coming in. And she says, well, he doesn't think it's severe enough. Maybe he wants to take a Tylenol or an aspirin first. So I told her, I said, well, back pain in general is not good. It's not normal. And for you to have it more than consistently, that is more so than once a week, that happens consistently for more than 6 to 12 weeks, where you start feeling something in your back, that is not normal. So today I want to break down what is normal, what is not normal and severe that you need to really seek help. All right, can your back hurt once in a while after you do something that you haven't done for a long time? Sure. Maybe it's the spring and you start gardening. And when you come back home after hours of gardening, because it's the first time of the season, your lower back gets really, really sore. And maybe you wake up the next day with an ache. Is that normal? Yes, that's normal, because a lot of times you just haven't stretched the right way, or you needed to warm up your muscles and you haven't taken enough breaks, right? But if the next day, here's the abnormal part of it, if the next day the pain starts shooting down your lower back, into your buttocks, down your legs, that is not normal. You should not be waiting it out, right? What's normal? You go for a hike, after a hike, the day after, once again, maybe your back is a little bit achy, you felt like you carried a heavy backpack, maybe you had your kids with you. It's the first hike of the season. You wake up with it, it gets a little bit stiff, but you walk it off and it's good to go. That could be normal. Once again, maybe you're stiff, maybe you didn't get enough rest, maybe you just need to hike a little bit more often, right? What's not normal is you wake up the next day, you get into your car, and then when you get out of your car, boom, your back goes out on you. And now you're out of service for hours or even days at a time, right? So for some of you who are sitting there watching this, you might say, well, my back only goes out on me once every couple of years, once a year, maybe once every few years. What's normal is if your back maybe aches a few times a year after an activity that you can explain. What's not normal is if your back goes out on you randomly and there's no rhyme or reason that it goes out. Or I hear people say, you know what, my back just goes out on me and I'm out for a few days or a week, but it only happens once a year or once every 3 to 4 years. That is not normal. That means it's getting worse. Now, what are other signs of lower back pain getting worse? Anytime your back stays in pain for more than a couple of days is not normal, okay? Anytime it happens more than once a week for consistently a few weeks is not normal. Anything that happens where it now lays you out for a few days is not normal. Anything where your pain starts shooting down your buttocks, down your legs, I don't care where it starts shooting down. The moment it exits your back and starts going to other places, it's not normal, okay? So that is pain traveling, pain frequency, pain intensity, and then the duration, the amount of time, all right? So those are all the abnormalities. Now, how do you know if there could be other things that's causing some severe back pain? If your back pain is happening right at the lower ribs into your lower back and it's on the side and it's kind of high back here, that might be your kidneys. So get your kidneys checked out. If you're having back pain that's shooting up your right shoulder blade, just on the inside of it, and it's like a piercing pain, usually after a meal or wakes you up in the middle of the night, and it's one of those times where it just happens, like boom, there's no rhyme or reason for it, that could be your gallbladder, right? So that can cause back pain as well. Sometimes your back pain can be a referral pain from the upper back or the neck, or it can be a referral pain. Sometimes your back pain can actually come from your legs, going from the bottom, traveling up. And that's another problem, okay? Some people know that as neuropathy or peripheral neuropathy. It can travel from your legs, get to your knees, but when it's bad enough, it can go up your knees as well. So those are some severe signs. If you have back pain and maybe it follows up with severe fever or shortness of breath, right? That can be something serious. Maybe there's something going on with the spinal cord as well, meningitis, right? Where you feel like you're just super fatigued and you're getting that fever, high fever with back pain. That's not normal. So that could be something that you need to get checked out, right? So I've really taken the time to go over with you all the severe back problems that you could have. Once again, if it becomes too long duration, right? Anything more than 6 weeks, all right? Anything happens consistently for more than 6 weeks. Any back pain that lasts more than 1 to 2 weeks, that's not normal. Any back pain that's more than an ache, and if you think that the intensity can sometimes get to a 6, 7, or 8, that's not normal. Anytime when the back pain starts referral pain from your buttocks down the legs, that is not normal, all right? So make sure you take great care of your back, because 80% of all musculoskeletal problems that goes into the emergency room is because of back pain. In the US, we consume more pain medications than any other country in the world. We actually consume about 80 to 90% of all pain medications in the world. And the number one medication that people take it for, or the number one symptom and illness that people take it for, is lower back pain, all right? Billions of dollars every single year is lost in production for back pain. And a lot of people lose time with their families, trips, right? Think about the last time your back went out on you. What were you not able to do, right? So you have to take great care of your back. Know when it is severe enough to seek out help, all right? Until next time, I'll see you guys later.